Hello, my name is Dr. Monica Flores. I'm a pediatrician in South Florida since 2001. The COVID vaccine. To vaccinate or not to vaccinate? That is the question. When decided to opt in or out for the COVID-19 vaccine, you should take into account that currently the COVID vaccine is being offered because of an emergency use authorization, which allows the emergency use of drugs and biological products during a pandemic, meaning the vaccine has been studied, found to be safe enough to use, and it does protect against COVID-19. But how long? What are the long-term effects, positive or negative? We just don't know. We're learning as we go. For me, the decision to vaccinate came down to, did I want to run the risk with live COVID-19 disease, or did I want the risk of a relatively new medication in order to protect myself against a potentially deadly disease? I personally opted to vaccinate myself, but that decision is up to every individual. Today I'll be reviewing the Moderna vaccine, which is currently approved for ages 18 years and older and being administered first to healthcare workers and then to those 65 and older. The Moderna vaccine contains a molecule called messenger RNA with instructions for producing protein from the virus that causes COVID-19 disease. The mRNA from the vaccine does not stay in the body, but is broken down shortly after vaccination. Moderna does not contain the virus. It does not enter our DNA. When a person is given the vaccine, some of their cells will read the mRNA instructions and temporarily produce the spike protein. The person's immune system will then recognize this protein as foreign and produce antibodies and activate T cells, which are a type of white blood cell. If later on the person comes into contact with SARS-CoV-2 virus, their immune system will recognize it and be ready to defend the body against it. The Moderna vaccine does not contain any preservatives and therefore has many rules on how to keep it safe until used. Unpunctured vials must be protected from light and stored either frozen or refrigerated for a maximum of 30 days, or at room temperature for a maximum of 12 hours. Vials cannot be refrozen. Prior to use, the vaccine must be thawed. Once the vial has been punctured, it needs to stay cold, and after 6 hours, needs to be discarded. The product is white to off-white, and it does contain white or translucent particulates. Providers who are administering the vaccine have to log the vaccine into a separate system so the vaccine effects can be continued to be studied. Because of all these rules, it's very important that if you decide to take the vaccine, you show up for your appointment on time, so no vaccine product is wasted. The vaccine is given in the muscle. It has 2 doses and should be given 1 month apart. It has been shown to protect against COVID-19, but we don't know how long. They're still doing the clinical trials. The vaccine facts will be updated and made available to the public as we learn them. As always, you should not get the vaccine if you are currently sick. A vaccine is going to trick your body into thinking you have been infected with coronavirus, and during that process, your body will form a defense system that will, in theory, protect you from COVID if you're exposed to it later. If you're already sick, then you run the risk that your body will not form a strong enough response, or your body may be overwhelmed and allow the first illness to get stronger and stronger. So you should be completely healthy before you take the vaccine. If you're pregnant or thinking of becoming pregnant, you should not take the vaccine. We have no idea the effect of the vaccine on children, and less of an idea on that tiny little baby being formed inside. If you're breastfeeding, you should discuss your options with your gynecologist. The vaccine is inactive. Therefore, no live coronavirus particles will be transferred through the breast milk. It is possible that the mRNA in the vaccine, or the antibodies you form, or the T cells that protect you are transferred in the breast milk. And what's their effect, we just don't know. You should only get one type of coronavirus vaccine. Don't mix them up like a cocktail. If you have a bleeding disorder or on a blood thinner, any shot or bump or bruise can cause bleeding. If you have low immune system, you may not form protection against the virus because your immune system does not work. And when we give a vaccine, any vaccine, it's possible that your immune system may become too active and exacerbate underlying conditions like lupus, rheumatoid arthritis, etc. You definitely should not get any vaccine if you have an allergy to the first dose, or if you have an allergy to any of the listed ingredients. Thankfully, the ingredient list is pretty short. Like most vaccines, you could get a little arm pain, some swelling of the lymph nodes, some redness and hardness around the injection site. Sometimes because your immune system is revving up and being tricked into thinking you are sick, so it forms long-term immunity, you may feel sick and you get a slight headache, fatigue, muscle pain, joint pain, chills, nausea, vomiting, or fever. There's a very slight chance that you can have a severe allergic reaction, not be able to breathe, a swelling of your face, a fast heart rate, a rash, dizziness, or weakness. That's why you're being asked to stay for a minimum of 15 minutes after administration of the vaccine. If those symptoms appear later, you should seek emergency care immediately and do not get the second dose. Any severe effects will be reported to the FDA CDC Vaccine Adverse Event Reporting System, which providers use for all vaccines to identify potential life-threatening effects. Side effects can also be reported to 1-866 Moderna. Severe effects that need to be reported include but are not limited to vaccine administration errors, multi-system inflammatory syndrome, cases of COVID that result in hospitalization of death, a life-threatening event, inpatient hospitalization, birth defects, and medical events that require intervention. You can enroll in vSafe. a smartphone-based tool that uses text messages to check in with people that have been vaccinated and remind you to take a second dose. If you require additional information, visit the CDC or the FDA websites. In the end, the decision to vaccinate or not against COVID will be a personal choice. For me, it was about risk, self-protection, and the need to experience the vaccine effects myself before recommending it to family or patients. I hope this information helps you in making an educated decision.